There are more than 37 million people in the United States are living with chronic kidney disease, CKD. However, CKD is a very difficult disease to recognize because they have no symptoms until your kidneys are already very weak. So once you've been diagnosed with CKD, the disease progresses very quickly. If you can slow your CKD, you could delay the need for treatment of kidney failure. The types of changes you might make to help your heart or the rest of your body will help your kidneys too. Here are 11 things you should do to limit harm and protect your kidneys. 1. Keep your blood pressure within the target range ordered by your doctor. Even if your blood pressure was low your whole life, it may be high now, and it may be hard to control. It is normal in CKD to need more than one blood pressure medicine. Check your blood pressure at home. Keep a log of the results so you can tell your care team when it is high or low and what times you take your blood pressure pills. Talk with your doctor if you have side effects. A different medicine might work better for you. Exercise can help lower blood pressure too. 2. Keep your blood sugar within limits. Diabetes is a serious disease in which your body has trouble controlling the level of sugar in your blood, also called glucose. Over time, having high blood sugar can cause damage to your eyes, nerves, heart, blood vessels, and kidneys. Good control of blood sugar and other self-management actions can help slow or stop this damage from happening. You can ask your doctor what your blood sugar targets should be. Not everyone will have the same blood sugar target. In general, the recommended targets for most people are: before meals, 90 to 130 milligrams per deciliter. 2 hours after the start of a meal, below 180 milligrams per deciliter. A1C test, around 7%. 3. Avoid certain pain pills. Non-steroidal anti-inflammatory drugs, NSAIDs, can cause kidney damage. Kidneys need a strong blood flow to work. NSAIDs reduce blood flow into and out of the kidneys. In most cases, it takes years of daily use for NSAIDs to cause CKD. But, once CKD is present, NSAIDs can make it get worse faster. Talk to your doctor about treatment options for pain that won't further harm your kidneys. 4. Maintain a healthy body weight. The 10-year Cardia study of young people, average age of 35, found that the more people weighed, the faster their kidney function fell. This was true even if they did not have diabetes or high blood pressure. It's hard to lose weight, but it can be done, and there are many ways that can work. Ask for help from your care team if you need it. 5. Do not smoke and use street drugs. Smoking and most street drugs can harm the kidneys. Of course, if quitting was easy, everyone would do it. There are a number of ways to quit smoking, from going cold turkey to patches, nicotine gum, or e-cigarettes. Even cutting back may help. If you use street drugs, you may need a rehab program. 6. Keeps blood pH balanced. A healthy blood pH is between 7.38 and 7.42. When the kidneys don't work well, they can fail to keep the acid-base balance in your body. Acid can build up from protein foods you eat. Grains and protein foods like meat, eggs, dairy, beans, and peas form acid wastes, then they break down. Your body needs protein for muscles and self-repair. But, most of us eat a lot more protein than we need. A low-acid diet, with lots of veggies, is one way to help kidneys last longer, at least if you are older. Ask your doctor if sodium bicarbonate can help protect your kidneys too. 7. Reduce protein in meals. When protein breaks down, it forms blood urea nitrogen, BUN. Removing BUN is hard on the kidneys. When you eat less protein, you make less BUN, which can help your kidneys last a bit longer. Research has found that eating very little protein can help even more, but this is hard to do, and there is a risk of malnutrition. 8. Limit shellfish. Research has found that a toxin called domoic acid in shellfish and some fish that eat algae can harm kidneys in mice. People are not mice. But, the really troubling finding was that very tiny levels of the toxin could harm kidneys. Shellfish also have high levels of purines, which can be a problem if you have gout. So, it may be wise to cut back on shellfish if you eat it a lot. 9. Don't eat canned food. Most food cans in the US are lined with bisphenol A, BPA. BPA has been linked with high blood pressure, diabetes, and obesity. Many canned foods tend to be very high in salt or sugar and highly processed, too. Glass jars or shelf-safe cartons don't have BPA. Watch more videos on how to cure kidney disease naturally in the description of this video.